In our previous section, we talked about outdoor air pollution and various major types and sources of that pollution. And in this section, we're going to be looking instead at indoor air pollution. And it may surprise you to learn that indoor air pollution poses greater risks to people's health than outdoor air pollution does. And there are several reasons why this is the case. Indoor air pollution contains higher concentrations of toxic pollutants than outdoor air, and we'll talk about some of the indoor sources of those pollutants in just a moment. Also, most people at least, tend to spend more time indoors compared to outdoors, and so they end up getting higher levels of exposure because of this. And then finally, poor ventilation in many buildings can cause pollutants to remain concentrated indoors and exacerbate exposure levels. The sources of pollution found indoors can be very wide ranging. They can include pollutants from building materials like asbestos, chemicals that are used in pressed wood that gets built into furniture, household products that contain volatile organic compounds or other toxic pollutants, dust and dust mites, dander from pets, mold and mildew, emissions from gas stoves or gas appliances like carbon monoxide, also smoke if you smoke indoors. And indoor pollutants can also come in from the outside. One example is radon. So, radon is a radioactive gas that's produced when the uranium in rocks decays through natural processes. So, if you live in an area where there are known uranium deposits, then radon gas can seep up into the home and accumulate. So, home radon testing is an important measure to regularly perform if you live in one of these regions. Um, and it's also important to note that there's a big difference between which sources of indoor air pollution present the greatest threats here in the US and in other industrialized countries versus in less affluent countries that are still industrializing. In industrialized countries like the US, the most acutely harmful indoor pollutants are cigarette smoke and radon. However, in less industrialized countries, the most harmful indoor pollutants are byproducts of burning fuel for cooking and heating the home. Because often the fuels that are burned are not very clean sources and can include wood, charcoal, and crop waste. And there also usually isn't a containment system for those fires. They're burned indoors. And the NIH estimates that indoor air pollution is the cause of 2 million deaths in developing countries, and that a disproportionate effect of this falls specifically on women in developing countries because they are the ones that are often tasked with cooking and therefore end up with higher exposure to these fuel byproducts. So, what are the health impacts of being exposed to air pollutants, whether indoor or outdoor? Well, short term acute exposure can cause some immediate effects, including eye, nose, and throat irritation, headaches and dizziness, and fatigue. But also, there are long term effects that result from extended exposure. And these can bring about conditions in a wide range of body systems. Respiratory disease, meaning diseases of the lungs, as well as cardiovascular disease, meaning diseases of the heart and circulatory system. Those are known to be caused and worsened by air pollution. There are also less obvious ones. Air pollution affects the brain, has consequences for learning ability, memory, and behavior. Exposure to certain pollutants has also been linked to cancers, and it's also been linked to reproductive health dysfunction. And of course, the likelihood of any of these health conditions manifesting depends on several factors. It depends on the level of exposure that a person experiences, the number or frequency of exposures, their age, because people who are elderly and also children are more susceptible, and the presence of pre existing medical conditions and comorbidities that can make a person more susceptible. And then there's also just individual sensitivity levels for each person. So just as people can experience different allergies, they can also experience different levels of sensitivity to various pollutants. The research on the health effects of air pollution exposure is so extensive, and a comprehensive look at it is well beyond the scope of what we're learning in this course. So we're just going to limit our discussion to the 6 criteria pollutants that we covered in the previous section, and we're going to summarize the health effects of each one. So exposure to ground level ozone is known to cause decreased lung function, coughing, shortness of breath. For people who have asthma, it aggravates their condition, and it's also known to cause an increased need for medical treatment and increased admission to hospitals. Exposure to particulate matter in the short term can aggravate heart and lung diseases in people who have these as a pre existing condition, but exposure in the long term can actually cause these conditions to manifest. Exposure to lead damages the nervous system, and children are particularly susceptible. In children, lead exposure causes IQ loss, learning disability, memory difficulties, and behavioral difficulties. In adults, it is known to damage the cardiovascular system in the kidneys. Nitrogen dioxide aggravates cases of lung disease. And it also makes people more susceptible to catching respiratory infections and weakens your defenses against respiratory pathogens. High levels of nitrogen dioxide have also been shown to increase hospital admissions for respiratory conditions. Carbon monoxide, as we said before, reduces the concentration of oxygen traveling to the body's organs and tissues, and this aggravates cases of heart disease and leads to increased hospital admission rates for people experiencing cardiovascular symptoms. And then lastly, sulfur dioxide aggravates lung disease in cases of asthma, especially among children.